First, I want to thank Carolyn Aldeget, or we call her Bo, and the Prevent Cancer Foundation for creating the James L. Mulshine Leadership Award, which recognizes the guidance and leadership that James Mulshine has provided over many years. I have known Jim since 1999, when I first met him and he introduced me to Bo. They have both been extremely important in moving screening forward and very supportive of our entire screening team. I want to use this opportunity to thank them, as I cannot really truly express how much that meant to us. The eight James L. Mulshine Leadership Awards have demonstrated the broad scope and vision of their joint leadership. I have been honored to have been a recipient of this award, which I treasure. Actually, it's standing right there, and it inspires me every day. So it is a great honor and privilege to present the 9th James L. Mulshine Leadership Award to Dr. Mary Pasquinelli. Mary has been a practicing nurse since 1985. During that time, she stayed deeply involved in strategic scholarship issues, which culminated in her receiving a doctorate in nursing practice from the University of Illinois at the Chicago College of Nursing in 2018. Dr. Pasquinelli initially provided care for people having bone marrow transplants and HIV disease, and saw the importance of providing outstanding health care in a diverse and often disadvantaged community setting. In 2015, she became the principal investigator of an IRB-approved study on health disparities assessment in the lung cancer screening program, which she established at the University of Illinois Medical Center. This study reflects her longstanding interest in health outcomes in challenging settings, including lung cancer screening. She has consistently focused her attention to addressing health disparities. Currently, she serves as the director of the lung cancer screening program and as a nurse practitioner for the pulmonary and medical oncology for lung cancer service line at the University of Illinois Hospital. The University of Illinois Screening Center is housed in a federally qualified health center and serves an underserved community in the Chicago urban environment, principally composed of African Americans. She has also developed a dedicated lung nodule clinic, which evaluates pulmonary patients who are at high risk of lung cancer and provides clinical care to medical oncology patients diagnosed with lung cancer. Mary's work is particularly meaningful to me on a personal note. I received my medical degree from Howard Medical School in Washington, D.C., and trained at DC General. I first saw, I really saw at firsthand the need for such efforts, and I congratulate Dr. Pasquinelli for her tenacious and impactful efforts in this area. Lung cancer is the #1 cancer killer, and I am paraphrasing a quote from James Mulshine, who described lung cancer screening as the most significant curative breakthrough in modern time in the war on cancer. However, the remarkable potential of this new screening service will not be realized without the remarkable efforts of people like Mary, who are now on the front lines of making this happen. Her efforts in lung cancer screenings demonstrates to me convincingly that CT screening for lung cancer is here to stay. Given the growing momentum of this service, I'm confident that lung cancer screening will now achieve the widespread implementation to truly achieve the early cures that it can provide. When my team started back in 1992, it looked like an almost fanciful oddity. Fortunately, after our 1999 Lancet publication, there was a great surge of hope for increasing the prospects of lung cancer cures. But this was followed by a tremendous pushback. Even after the publication of the definitive randomized trials in the US, the National Lung Screening Trial and the Nelson Trial in Europe, both of which definitively confirmed our screening results, The national uptake of lung cancer screening has been dismal. The naysayers are still actively discouraging national screening uptake. However, while barriers against screening have been strong, I now see real hope for a much more rapid implementation of screening because people like Mary are there to work on this, and I will tell you why. Dr. Pasquinelli represents the front line of lung cancer screening as she's bringing this life-saving screening to underprivileged people at risk of lung cancer. She works directly in communities of underserved individuals, and she has a true knowledge of their problems in working within that academic center. She's published papers that pragmatically address the bottleneck issues. It is this type of work from people who've actually lived these experiences that ultimately overcome screening hesitancy and will have the great impact in reducing lung cancer deaths. Further, Mary approaches her work with a global perspective as she routinely works with groups across the world, including Cambodia, Haiti, Guatemala, Tanzania, and India, and probably many more that I am not aware of. Such international collaborations have always been very close to my heart, as I think it is very important to share innovations and challenges throughout the world. In her position as a nurse practitioner, Mary has run a screening program. She provides substantive input to various local, national, and international healthcare organizations, as she has deep firsthand knowledge of the issues of women and minorities in regard to lung cancer screening. She understands that the growing participation of lung cancer screening, especially in medical underserved communities, is currently the biggest challenge. This is a particularly sensitive public health issue and challenge for this tobacco-related disease, given the long history of predatory tobacco marketing in the very same communities. This reality was indelibly sketched in my mind after hearing Sharon Eubanks recount her experience in leading the prosecution of Philip Morris versus the United States at this same workshop in 2018, when Sharon received her leadership award. However, Mary's impact extends beyond developing and running a busy and successful screening service, as she has also published 5 important papers and given many talks about the screening experience, with special emphasis to addressing health equity for this new cancer screening test. Her work and leadership also highlights the efforts of screening champions throughout the US and the world who are working to overcome fear, misinformation, and indifference to bring lung cancer screening services to the vast populations of individuals who are or used to smoke. These individuals all share the high risk of lung cancer throughout their lifetime, as they remain at elevated risk and then die of lung cancer. We now definitively know that lung cancer screening can change this dreadful fate. Medical professionals like Mary are succeeding against all odds in bringing this service forward. Lung cancer is the leading cancer killer across the globe. And as I mentioned earlier, some consider lung cancer screening as the most significant breakthrough in modern time in the war on cancer. However, this potential will not be realized without the work of people like Mary, who are essential and are on the front lines delivering the service even to the most vulnerable populations, while continuing research to further refine the process and enable even greater benefit from screening in the future. Congratulations, Mary. It means a lot to me. Thank you.
My name is Jim Mulshine. This is a special day for me as well as for others. And I just wanted to give you a little background. This is a workshop that we started 18 years ago with the Prevent Cancer Foundation. The original group starting this included myself, Rick Avila, David Yankelevitz, Stefan Schaller, and we were focused on integration of quantitative imaging into improving the process of lung cancer screening. And after the first couple of years, it became obvious that to do this right, we had to involve a lot of other communities because there were many aspects of screening, including who should we screen, how do we do it best, what is the management, how do we relate to the surgical intervention, and all kinds of other things, especially in terms of making sure that the people that needed it most knew about this service and were comfortable participating. And so we very shortly realized that the key thing to this was to get the leading thought leaders involved in a very intense multidisciplinary conversation on this annual basis to just say where we are and what the big challenges were and what we could do about them working as a group. And so as this moved forward, it became very clear that individuals were doing extraordinary things in this field. And about 9 years ago, actually 9 years ago exactly, Bo came up with the idea that we should do a leadership award. Now, for reasons that kind of elude me, I got to be the named person for this award. And it's been a great honor. And we've had enormous amounts of fun trying to identify individuals that really have contributed in profound ways to the transformation of this field. And so we continue this legacy now. And we just heard from Claudia some amazing things about what Mary has brought to the field of lung cancer screening. So I'm delighted to be here. And this is yet another example of somebody who's made an enormous difference to the betterment of our society.
Thank you, Claudia. Your remarks were incredibly gracious, and we really appreciate your acknowledging the value of our workshop. But this workshop would never have happened without you and David and your team and the seminal work you did to ensure that lung cancer screening would become a national program in this country. And I think it's really important to point out that these quantitative images capture not only lung cancer, but also detect early COPD and early events that lead to cardiovascular disease. So this way, you get a CT scan, you get a threefer. And I think it's really important that we not lose track of that fact. And in mentioning that, I'd like to also acknowledge the American Lung Association, which has partnered with us on this workshop now for the second year. I'm going to lead off with two of my very favorite quotes because the Prevent Cancer Foundation has long been engaged in the issue of health equity. And since the late 80s, when we stood up our very first program addressing inequality in healthcare, I have often referred to this quote by the Reverend Dr. Martin Luther King, who said, "Of all forms of discrimination and inequalities, injustice in health is the most shocking and inhuman." And the second one I want to mention is my birthday mate, Mahatma Gandhi, who said, "Be the change you want to see in the world." And the reason I bring these both up is because this is what Mary Pasquinelli is doing every single day. She is being the change we all want to see in the world by bringing equity in healthcare to some of the most vulnerable patient communities in the city of Chicago. And it's my honor and privilege to present the James L. Mulshine, MD Leadership Award to Dr. Mary Pasquinelli.
Thank you. Okay. Thank you, Dr. Mulshine, Carolyn Aldoget, and the Prevent Cancer Quantitative Imaging Steering Committee. I was stunned when Dr. Mulshine called me to tell me that I was this year's recipient of the James L. Mulshine National Leadership Award. It took some time for this to sink in. I'm incredibly honored and humbled to receive this award. As a nurse practitioner, this award is very meaningful to me, as many nurse practitioners are now taking active leadership roles in the developing of lung cancer and early detection programs. Dr. Henschke, thank you for your kind remarks. You are truly one of the pioneers of this field and have paved the way for me and for many others to make a difference by use of CT imaging to improve health outcomes. In 2015, a few months after I was hired by the University of Illinois at Chicago with the goal of developing their lung cancer screening program, I was encouraged by a colleague to attend the Prevent Cancer Quantitative Imaging Workshop. This workshop highlighted the power of what CT imaging can achieve and the impact imaging can have on the early detection of tobacco-related diseases. Attending this workshop has given me the opportunity to network with some amazing people and gain knowledge that I have taken back to our university, which has contributed to the overall success of our program. During the evolution of our lung screening program, including the development of an incidental nodule clinic and a multidisciplinary thoracic oncology clinic, we identified racial and ethnic disparities in lung cancer screening. Not only did we see this as a health disparity, but we saw this as a social injustice. To address this problem, we took a deep dive into understanding our lung cancer screening and lung cancer population, and our published research on health disparities added to the growing evidence that race and gender disparities in lung cancer screening criteria exist, and lung cancer screening criteria needs to be refined. We are constantly working to improve our program and to optimize the ability to use the results of the low-dose CT as a teachable moment to help our patients understand the health of their lungs and to provide personalized care to decrease their risk of tobacco-related diseases. Dr. Mulshine, you are a true visionary. Your leadership and the work of this committee must be commended. At this workshop, the latest advances on imaging technology are discussed, from novel tools to assess image distortion, quality improvement initiatives, and forming a global collaboration to share and analyze low-dose CT images worldwide with the use of machine learning. Dr. Hinchke and the ILCAP collaborative research team advances our knowledge regarding nodule characteristics, volume doubling time, algorithms to decrease false positive rates, optimization of screening intervals, and survival outcomes. This information has been vital to the evolution of screening practices. In addition, the multidisciplinary framework of this nodule highlights the importance of public policy, advocacy, population health, equity, and financial analysis to better understand the impact of lung screening. The work that the Prevent Cancer Foundation has done, from workshops, grants, research, and education, has been incredibly valuable. I want to tell you that the lung screening community is listening and acting. We are collaborating and sharing best practices. We are translating research to clinical knowledge to improve lung screening programs and outcomes. We are conducting research. We are reaching out to vulnerable communities and populations and forming community partnerships, and we work to overcome barriers to improve access to connect high-risk individuals into screening programs. I want to thank my multidisciplinary team at the University of Illinois at Chicago, who has supported and guided our work. I want to thank my co-authors on our published work, specifically Dr. Lawrence Feldman, Dr. Kevin Kovitz, and Dr. Martin Tamamagi, for their guidance and mentorship. I want to thank our patients who put their trust in us every day. And finally, I want to sincerely thank the Prevent Cancer Foundation for recognizing and supporting our work. Thank you very much.
That was great.